Hey, how's everybody doing today? Hope you're having a wonderful and a positive day today. I'm Angie Devon, and I just wanted to jump on here quickly and tell you about, first of all, who I am. I am the founder and CEO of Proactive Patient Advocacy.org, where our mission is to assist everyone to navigate the healthcare system effectively and proactively. So, today I want to talk a little bit about COVID-19. Unless you've been living in a bubble, I think all of us know what COVID-19 is, the invisible virus that has been spreading and still has not yet been contained. With that, back I'd say a few months ago, maybe in March, a lot of doctors ceased having patients coming into the office for fear of spreading COVID because what has been found out is that people that are asymptomatic or people that don't have symptoms can be a carrier of the virus. So, what they started offering at that time was virtual visits. And they're still offering currently virtual visits, but most providers' offices or doctors' offices now are allowing patients to come back into the office. However, if you are one of those that has a compromised immune system, you may be a bit older, you still may not feel comfortable coming into a doctor's office right now, which I totally understand. So, again, a lot of doctors are offering virtual visits. Um, they're called telehealth visits. So most are offering either phone visits where you can call or your provider will call you and you can set up a phone visit with your provider, or you can do it virtually, what they're calling video visits. And a lot of times, in order to do the video visits, you just have to download that provider's particular app. And it's really simple. It's no different than downloading any other app on your phone, a grocery app, Facebook, Instagram, any type of app like that is really simple. You basically just go to the Google Play Store and your provider will let you know specifically which app you need to download for them. You download it to your phone, it's very few steps. Voila, you're able to do virtual visits with your provider. So once you've downloaded that app onto your phone, after you download the app, and your appointment has been scheduled. Oh, let me back up and say this. Some providers are not offering where you can go online and schedule your own virtual or phone visit. You may have to call your provider's office and schedule that with someone. But once you have scheduled your either phone or virtual visit with your provider, um, you can check yourself in like 3 days before your appointment time, again saving more time because everybody's in time crunch mode, right? So once your visit has been scheduled, say like today is Friday, your appointment is on Monday. If your appointment has been scheduled today for a virtual or phone visit, you can go into the app once you have downloaded it and go ahead and register yourself. You're updating your demographic information, your insurance information, um, so that everything is current when you do have that visit with your provider. And I do want to state that it's very important to have your insurance information up to date. But I'll talk about that in a minute. Back to the virtual visits or the phone visits. First thing is you want to be sure that you are on time for your visit. Very, 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 very important. Don't know how I can stress that enough. So say you've got an appointment for 1:30. Okay, if you haven't checked yourself in already, which basically means you have pre-registered yourself, you want to do that and be prepared for that visit at least between 1:30 and 1:45 if you've got like a 2 o'clock appointment. The reason I say that is sometimes doctors are ahead of their schedules and they're ready to see you a little bit earlier. So you want to be prepared in advance so that everybody stays on time. So again, make sure if you downloaded the app, go ahead and register yourself. You can do it like 3 days ahead of time. and definitely be available during that time period, because sometimes they have to call you. They want to make sure that you have downloaded your app and you're ready to go. You don't want to wait 15 minutes before your appointment time to go ahead and download your app and put in all your information, because that can make you late for your appointment. And the other thing about being late is, if you continually, with some providers, you're continually late or no show for your visits, that can lead to dismissal from that practice if you have continuous no shows and you're always late. So most practices do allow you a 15-minute window to arrive for your visit, either virtually or in person. And it's very important to be there within that 15-minute window, because if you show up 20, 25, 30 minutes after your scheduled appointment time, chances are you may not be seen. And that causes a lot of frustration on your part, but it's very important to keep your scheduled appointment time, because providers are on a schedule with other patients. But getting back to the virtual visits, again, register yourself in advance. It's really simple. It's not that difficult to download the app to get your information. You can also upload information, like um, if you have new insurance since the last time you saw that provider, you can upload your most recent insurance information or insurance card. Uploading your demographics, your phone number, your address, things like that. It's always important to keep your chart with your provider up to date. It saves a lot of headache down the line. But once you've downloaded the app and you're ready to go, be ready at least 15 minutes ahead of time. Very important. Um, be prepared, because when they call you, you want to be available. You want to be available so you can have your visit, go on with your day. Everybody is about time management, right? So that's very important. So once you have downloaded that app, you've uploaded all of your, or not uploaded, um, updated any current information. Um, your doctor's office will give you a call. It may be 15 minutes prior to your visit time. And, uh, some providers are doing things differently. So you may get a call from the front desk person to be sure that your app has been downloaded and you're ready to go. You may then get a call from a medical assistant or a nurse to go over some information with you, your chart, like going over your medications and things, making sure that your chart um, is up to date. And I should also mention, if you can, I know everybody cannot, because you are doing these visits virtually or by phone, it's helpful if you can have vitals available. And I know everybody can't do that, but some vitals you can have readily available for the doctor. If you can provide your height, your weight, that's generally pretty easy to do. Your blood pressure, if you have a cuff, and if you are hypertensive, it's probably a good idea to have a blood pressure cuff. Just to check on your blood pressure on a regular basis. So height, your weight, temperature, if you can. Most people do have a thermometer. Your pulse, if you can. If you have a pulsometer, God, I know what that thing is. I hope I said it right. Um, that reads your pulse. You just stick your finger in, and it will read your your pulse. So height, weight, temperature, blood pressure, pulse, any of those that you can provide to your provider will be very helpful. Just as if you were going into the office, except you're doing everything now virtually, or you're doing it by phone. So, be prepared, and then you'll have your visit with your provider. Now, some providers, again, if I didn't mention, um, you can schedule these through my chart. I'm going to talk to you about that in a second. Or you will have to call the doctor's office to schedule the virtual or phone visit. Just let them know. Okay, so I think I already talked about no shows. It's important to show up for your visit, um, at least reschedule. Just no shows, just that never looks good, especially if you have a lot of those you're continually no showing. It definitely can get you dismissed from the practice eventually because they feel like you're not serious about coming into the office or keeping your appointments, and that is very important for um, your health care. Um, I'm looking at my notes because I want to be sure I didn't overlook anything. So be mindful of no shows, be on time, be prepared 15 minutes early, available, and ready for those visits. Insurance information, that is very, very, very important. I cannot stress that enough. So say you had Blue Cross Blue Shield all of 2019. This year you have United Healthcare. That old information is still going to be on your chart if you don't let your provider's office know, or if you don't upload it yourself to your chart to update your insurance information. It's important to have the correct information on file because if they bill an old insurance, of course, it's going to get denied because you're not covered, and then you're going to get a bill, right? So nobody wants to see or get unnecessary bills. So it's very important that you keep your insurance information updated with all the providers that you see um, for effective billing, and so that you're not getting unnecessary bills. And another thing is, some people will say, well, I had Blue Cross Blue Shield last year. I got a new card this year, but everything is the same. Sometimes that information changes and you may not notice. Your copay could change, your whole plan can change. So you could have had an HMO last year, which was Blue Cross Blue Shield. This year you could have a PPO. Two totally different plans going on. And I'll talk about that in another segment that can get pretty detailed. But when a doctor's office asks you what type of insurance that you have, and you just say, oh, yeah, I have Blue Cross Blue Shield. Some people don't know if you don't work with insurance. Blue Cross Blue Shield is a large entity and a very large insurer. So that's like telling me if I ask you what type of car you drive, I drive a Ford. Okay, Ford makes a lot of different makes and models and styles, trucks and cars. So you have to specify to the person that you're giving your insurance information to the information on your card. If it's HMO or PPO, very important. And for people that are on Medicare, it's not just the traditional Medicare plans anymore. Now you have HMOs, you have PPOs with Medicare plans. They're called Medicare Advantage plans. All of those plans are very different. Some providers accept some of these plans and some do not. So it's very important to know or be educated about your insurance. It saves a lot of trouble down the line. I'm going to do another segment on insurances, but today I just want to kind of hone in on virtual visits if you're not comfortable coming into your provider's office. Um, so we touched on insurance. One thing I do want to say about insurance is um, because the telehealth for some providers, it's pretty new. So because of COVID-19, a lot of insurance carriers are now, paying for virtual visits. You may want to check with your insurance carrier to see if a deductible applies, if it does not apply, if that's something that is covered. And um, if you don't feel comfortable doing a virtual visit and you are coming into the doctor's office, one thing I do want to mention is with COVID-19 all around us, we can't see it, right? But we know it's out there and it affects us. So you want to have a face covering on not only when you walk into your doctor's office, but when you step into that building, you want to have on a face covering or mask. Most providers' offices now, um, when you come in, it is required that you wear a face mask or covering. If you don't have one, they will provide one for you, but For me, it's just best that when you step into the building already, that you have that face covering or mask on to protect yourself. Um, and you can be protecting someone else because you don't know if you're a carrier or not. But that's just what most providers are asking for now when you come into the office. So of course, if you're doing a virtual or phone visit, none of that is necessary. But it's just important to, during COVID-19, particularly for people who have compromised immune systems, or anyone just keeping up with your health care, which is very important. You want to keep up with the preventative health care before something happens. That's why it's important to go to see your provider routinely, particularly for physicals and things like that. Prevention is the key. So the virtual visits are an option for not coming into the office. So again, download the app. Your provider will tell you specifically which app you need to download. Prepare yourself 3 days in advance. Upload all of your information, your insurance, excuse me, your insurance information. Sometimes, depending on the type of visit that you are having, there will be questionnaires that you'll have to answer. So that's why it's important to register yourself ahead of time instead of waiting like, okay, I have an appointment at 2 o'clock, it's 10 minutes to 2, I'm going to go ahead and, register myself. Because sometimes, like I said, depending on what you're being seen for, the doctor may have put a questionnaire on there that may take, a few minutes of your time to complete. And you want your doctor to have all the information when you are seen for that visit. So be proactive and, do your homework ahead of time so you'll have a seamless visit. So if you're going to do a phone visit, of course, you don't need my chart. What's my chart? Most providers do have what they call my chart. It's like a virtual chart, if you will, of yours, where it houses all of your providers. You can upload insurance information. You can get your test results. You can request medical records. You can cancel or reschedule your own appointments without having to, pick up the phone, be on hold. It's just a very great tool, and it really is user friendly. Some people are afraid of it, but it's really user friendly and it saves a lot of time. So if your provider does offer my chart, my suggestion to you would be to download it. Your provider's office can send you the link for that, real quick to set up, like any other thing you do online. You have a password and a username. Boom, you're done. So instead of calling the doctor's office with the question and you have to speak to someone at the front desk and then they are communicating that onto a clinical person, then it gets to your provider to answer or address your concerns. If you have my chart already, you just go directly into my chart, communicate directly with your doctor. You're bypassing the middleman and you're sending your message directly to your provider. It just saves a lot of time and it's more efficient. So if you haven't tried my chart, you might want to try it out. It's really user friendly, easy to do, and it saves a lot of time. And hey, you can use it from your phone. And most people now have their phones with them all the time, right? So it is kind of like no excuse, right? Oh, one thing I didn't mention, if you're going to do a virtual visit, it generally only works if you have a tablet or a laptop or your phone. That's generally how the mechanisms through which the virtual visit works. And virtual is just what it is. It's like a FaceTime meeting with your provider, except you're not in their office. Of course, there's some things you will have to come into the office for. Routine physicals, you will have to come into the provider's office for that. If you are a Medicare patient, however, Medicare annually requires their patients to have what they're called annual wellness visits. And I know it's still a physical. However, annual wellness visits do not require in-person visit and they can be done virtually. Just thought I'd throw that out there. Um, so keep that in mind if you feel that you can't come into the doctor's office. Um, the other thing is, even though you're going to see your doctor virtually and or by phone, and you're not coming into the office, you, the patient, still need to be educated about that visit and be proactive. So if you have questions for your provider, you think you have them in your head and you're going to remember, I would suggest jot those questions down maybe a day or so before your visit so that you don't forget. Because then you can address all of your concerns at your visit with your provider instead of waiting until after the visit and then it's like, oh, dang, I forgot to ask the doctor so and so and so and so. Well, it's just easier to get all of your information compiled at one visit versus having to come back or having to go through my chart or whatever and send a message. I mean, that's all well and good. But again, use my chart if you're going to do that because you're corresponding directly with your doctor. It's just easier if you jot your questions down ahead of time and ask the questions then at the time of your visit. And there is no such thing as a silly question. If it's a concern to you, it's important. Jot it down for your provider so that they can address that concern with you at your during your virtual visit or your phone visit. I think I already talked about the face coverings. That's very, very, very important. So um, have your face covering or mask if you're coming into the doctor's office. Have that, I would say, um, when you walk into the building, not so much when you walk into the doctor's office. It's just very important. And most providers right now during COVID are not allowing visitors to come in with you. Now, you can have one support person, maybe someone that can articulate things better or know which questions to ask the doctor better than you do. That's fine. Or someone that you require assistance um, to get in and out and navigate through the provider's office. That's all well and good. That's the only type of visitor that is allowed with you, or at least just one visit, maybe your spouse. Um, they're not recommending or allowing, if you're bringing your children in with you to visits. Or a couple of friends or a couple family members are coming, only one person can come with you to your visits at this time. It's about the social distancing, not having large groups of people together in the waiting room. So keep that in mind as well. So I just mainly wanted to focus on virtual visits and phone visits versus coming into the office, or some things you need to do if you are coming into the office. But, COVID-19 is still out there. Here in North Carolina, our numbers are on the rise. So it's still wise to do the same things we were doing 2 months ago, right? Face coverings when you're in public, washing our hands frequently, and social distancing. They we find that those things tend to help. So we have to use, common sense. This is an invisible um, infection that's out there that we can't see, but it is there. So you want to be smart about that. So if you have any questions about um, insurance plans or how I can help you to navigate to download the my charts to do to get the virtual visit going so that you can see your physician or provider virtually, please reach out to us. I do plan to do a workshop in the future on insurance plans, um, regular group health insurance plans, in addition to Medicare plans, because there's a whole lot of those now, and they can be quite confusing versus just the old school traditional red, white, and blue Medicare card that has been around forever. And a lot of times people don't understand the difference between the two, or they think they have the same plans. So I plan to be doing some workshops again on insurance plans, getting more into detail about how to have a good visit, a productive visit with your provider. Um, and if there's any other concerns or questions that you have, feel free to reach out to us. If I don't have the answer, I can try to find it for you, go through my list of resources, or if I don't know the answer, again, I'll try to find it for you, because the healthcare system can be quite confusing and frustrating to navigate, to say the least. So we're here to try to assist you in that effort so that you don't get frustrated, give you some tips on how to have a productive visit with your provider, whether that is virtually or in person, because it's very important to stay on top of your health care. Whether you're young, especially as we are aging, like me, very, very important. So I don't want to keep talking, but please feel free to reach out to us. Again, I'm Angie Devon. I'm the founder and president of Proactive Patient Advocacy Incorporated. You can check out our website, proactivepatientadvocacy.org. We're also on Twitter, Facebook, and Instagram. And if you want me to do a workshop for you, I'd be more than happy. Of course, now we're not doing things in person. Everything is going to be virtual. I just wanted to get on here and kind of talk about virtual uh, visits, and we can do Zoom workshops virtually. That keeps everybody safe, right? But you're still getting the information. So feel free to reach out to us, um, website or any of those platforms that I just mentioned, and download the My Chart that your provider has for you. Utilize the virtual visits. Of course, go to the doctor if you absolutely have to. But if you don't feel comfortable going into the doctor's office, do the virtual visit, or do a phone visit. You're still getting your visit in, right? And your doctor is still laying eyes on you and still speaking with you, and, taking part in your healthcare. But you have to be proactive in your healthcare first. If you want to reach out to us by phone, our number is 919-438-4719. We'd love to talk to you, love to do a workshop for you. If you have any suggestions for us, feel free to throw those out there too. I'm all about suggestions and having an open mind. But my goal is to help you navigate the healthcare system and your healthcare proactively. Okay, thanks so much for your time, everybody. And I'll be back again, and stay healthy, and I hope to see you soon. Have a positive day. Bye.